Okay, so today we want to talk about lungs. Yesterday we talked about the pleura, right? Yesterday we talked about the pleura, so now we want to talk about the lungs. Okay, so now, so the lungs are these organs that are occupying the pleural spaces. Okay, they're occupying the pleural spaces that are lateral to the mediastinum. Okay, so remember, we said we have the mediastinum in between in the right and the left pleura. Okay, so basically, let's talk about these lungs now. So a lung, generally, if I show you, you have to know that this is a lung. Okay, so there are certain features of the lung. I'll use this lung over here, right, to illustrate that. All right. So for a lung now, these are the characteristics of a lung. So generally, it's pyramidal in shape, right? There with a base there, right? So it's pyramidal in shape, and this base is sitting on the dome. Okay, this base is generally sitting on the dome here, and then now we have the apex, right? The apex of a lung there. Okay, so that gives it its pyramidal what? Pyramidal shape thing. Okay, right? Um, then now the surfaces of a lung, right? We have the medial surfaces. So these are the medial surfaces that are in contact with the mediastinum, okay, or the mediastinal surfaces. Then we have the costal surfaces. So from there, so can you see the indentations of the ribs there? These are the costal surfaces all over the back there, right? Laterally there, going anterior, right? And then the borders of the lung, right? We have the anterior border, right? That anterior border. What you have to understand with the anterior border is that the anterior border of the lung is sharp. Okay, so the anterior border of the lung is generally sharp. And then the posterior border is generally rounded. Okay, so the posterior border of the lung is rounded. So you see that here it's rounded, right? The posterior border is rounded. The anterior border is sharp. So that's a sharp anterior border. Okay, are we together there? And that's the apex. And remember, we said that the apex of the lungs, they extend into the neck, right? Into the lower neck, right? They actually extend into the lower neck above the thoracic inlet there. Okay, right? Then these are the lower borders, right? So this is the posterior border, anterior border, and then the lower border. Okay, are we together? Right. And these lower borders are fitting in the recesses, right? The recesses or the spaces created by the diaphragm in the body wall. Because say if I have the body wall there, right, and then the diaphragm there, these parts, right, will be fitting into those recesses, right? Will actually be fitting into those recesses. Okay, actually be fitting in those recesses between the body wall and the diaphragm. Okay, so basically that's the general features of the lung. And then the lung now has got a root. So every lung actually is a root that we call the hilum of the lung, right? So remember yesterday when we talked about the pleura, we said that at the hilum of the lung, that's why we have the visceral pleura, right, in contact or continuing with the parietal pleura, right? It's at the hilum of the lung. Okay. Then the lungs generally have got lobes. Okay, so generally they've got lobes, but depending either it's the left or it's a right or it's a right lung. Okay, either it's a left or it's a right lung. Okay, so these are the lobes, right, created by the fissures. Okay, so those are the fissures that are digging deep, right, also on the medial surface. So if they ask you that the fissures appear both on the medial and lateral surfaces of the lung, that's true. Okay, so the fissures, we can see them there, okay, separating the lungs into lobes there. Okay, now, having said that now, we need to understand what is common and what's the difference between the two lungs thing. Okay, so between the right and the left lung. Okay, so we need to understand that, right? So now, let me just list these things here, then I'll explain them as we move on. Right, so for the right lung, it actually has got 3 lobes. So the right lung has got 3 lobes. The right lung has got 3 lobes. the left lung has got 2 lobes. So remember, we said that the left lung is smaller, right? Right? And then the right lung is heavier, right? And then the left lung now has got 2 lobes, which are the superior lobe and the inferior lobe. That means there's only one fissure. So there's only one fissure that is dividing the left lung, right? Then you go on to the right lung, there is superior and inferior plus an added lobe, that is the middle lobe, right? And the middle lobe, right? That means we have how many fissures? 2 fissures there, okay? We actually put 2 fissures there. And these fissures are the ones that I also listed here. That the 2 fissures, we have the oblique fissure, which is also here. So that one fissure separating the superior and the inferior lobe, right? That's the oblique what? Oblique fissure there. Okay. Then by that we have an added fissure there, that is the horizontal fissure. So the common fissure is the oblique fissure. So I want you to get that the common fissure is the oblique fissure, both in the left and the right lung. And then we have an added horizontal fissure there. Right. So by oblique it means it runs obliquely, right? By horizontal it means it just runs horizontal, divided into superior, middle, and inferior lobe, right? Our lung there is divided into those lobes, right? But for this one, only have got one oblique fissure dividing the lung into a superior and an inferior lobe. Okay. Having said that, this one is heavier. Now you understand why. This one is heavier and this one is lighter. So this is all you need for your spot test. This is very important. Okay. This is very, very important for your spot test. Okay. Right. Especially these, you know, observing the lobes, observing the fissures there, right? Observing the fissures. Also for the weight, it might not work in the dissection room, right? But for these, they always work in helping you to identify which part of the body that this lung comes from. Okay. Then we said the right lung yesterday is broader and shorter, right? We say it's shorter because the right dome of the diaphragm extends a little bit higher than the left dome. Okay. And then it's broader, right? Because the heart doesn't put a deeper impression, right, on it. This one is the opposite, narrower, right? And then it's also longer. Okay. Right. So that's about the difference in the lungs, right? So if we look at the lungs, they're placed, right, on both sides of the mediastinum, right? So can we see that the heart here, right, it's going deeper, right, putting an impression on the left lung, right, more than it would do on the right lung. Okay, that's why this one actually is then broader and heavier, right? Plus the 3 added lobes, right? So if you can see, we have the superior lobe there, right? We have the middle lobe there, right? And then we have the inferior lobe there. For the left one, we only have the superior lobe there and the inferior lobe over there. Okay, so it's clear now, right? So if you look from the back, we see that we have the superior lobe there, right? We have the middle lobe there, and then the inferior lobe over here. Okay, over there, right? And then for this one, only for the superior and the inferior there. Okay, right. But now, if we are looking at a patient from outside, okay, so surface anatomy now, let's talk a little bit about this surface anatomy. Right, we need to understand the landmarks that we can use, right, to identify the lungs, right? So the first thing is the pleura, okay, the pleura, right? So the pleura follows the diaphragm, right? Quite. The pleura will be following the diaphragm, right? The parietal pleura, actually. Remember, the visceral pleura is always adherent to the lungs thing. Okay. So this is how the pleura will be moving. So firstly, we start there, midline, right? Midline there, the sternum, right? My line is a bit swung there. But anyway, we use these lines. The mid-clavicular line, that's a vertical line passing at the midpoint of the clavicle, right? That's the mid-clavicular line. And then we have the mid-axillary line, right? Passing at the mid part of the axilla, right? So if we're looking from laterally, that would be a midpoint there, okay? The mid-axillary line. Then number 3, we have the vertebral line, so posteriorly there, okay? So these are the landmarks that we use. Okay, so if we go to the mid-clavicular line, right? Mid-clavicular line, right? So if I go to mid-clavicular line, at rib number 6, right? At rib number 6, mid-clavicular line, at rib number 6 there, right? Anyway, here we have a mix of information. Yeah, there was a mistake that was done there. But actually, for the lung, we're supposed to have this one coming here. So this is the information for the lung, this is the information for the pleura. There was a mistake done there. So anyway, let's say this is not for the pleura, this is not for the lung. So this is actually for the lung, right? And this is for the parietal pleura. Okay, so sorry for that. So anyway, let's wrap it off. Right. So now, with that, we need then to understand the landmarks. Okay, so let's talk about these landmarks. So the landmarks is that. So for the lung, actually, okay, so we'll start with the lung. We go to the mid-clavicular line at rib number 6, then we put a point. Okay, so there we go, rib number 6. We put a mark there, right? And then we go to the mid-axillary line, right, at rib number 8. So mid-axillary line at rib number 8. Then we come to the mid-axillary line, we cut me up there. Then we put a line, the mark there, right? Mark there. Then we go to the vertebra. At vertebra number 10, right? We go and put a mark. At vertebra number 10, we put a mark there, right? So if we're then drawing, right? So this landmark will be over here. So it actually be here, right? There. So we'll be drawing that landmark there, following that, coming anteriorly, right, up to reach the sternum there, right? So that is the border in mid-inspiration of the lung, right? That will be the border for the lung there. Okay. Now, then for the pleura, the parietal pleura actually, for the parietal pleura, right, it will do this. Mid-clavicular line, it will be at rib number 8. Okay, so mid-clavicular line, it will actually be at rib number 8. Let me use a different color there. It will actually be at rib number 8. Okay, so mid-clavicular, rib number 8. So we come, rib number 8, we put a mark there. Then we go mid-axillary line, it will be at rib number 10. So we come rib number 10 over there. Then at vertebra, right, vertebral line, we have got this rib number 12 there. Okay, so it actually be at rib number 12. So we put a line there. Right? So if I draw my line to rib number 10 there, right, from vertebra number 12, remember, rib number 10 right there, then up to 8 there, then that would be the landmark for the parietal pleura. Okay, so these are the recesses. Okay, so that's a recess, right? That called the coastal diaphragmatic recess. So it will be a recess between the body wall, right, and the diaphragm. That's where the lung will come to fit when you inspire. So this will be mid-inspiration, right? But by full inspiration, the lungs will actually descend to occupy all that space. Okay, so that in full inspiration, right, what we have is the lung will follow these lines, these ones actually, these lines. Okay, this is only at mid inspiration there. So this is so easy. If you look, there is only a difference of 2, right there, right? Mid clavicular, there's also a difference of 2 there. Mid axillary, difference of 2. Mid at vertebral level, difference of 2. 10, 12, 8, 10, 6, 8. So it's simple, right? So you just know from there we descend 2 levels. We are there. There descend 2 levels. We are there. There we descend 2 levels. We are there, right? What about here, superiorly? So we go on now to vertebral prominence. So remember, our vertebral prominence is C7. Okay, that's the first vertebra from above with the prominent spine. Okay, so they will be reaching that level there. Okay, so they'll actually be reaching that level there. Are we together, right? And then it will actually be, so the lung will run on the lateral parts, right, of the midline actually. So can you see that? The lung is actually running laterally, right, from the midline, right. But the distance actually from there to there is about 4 centimeters. Okay, but that's not much important for you to understand. If you just know that it reaches up to C7 there, right, up to up to T what? T10. Okay, so the extent is from C7 up to T10. That's there, right? That's the extent of the lung. What about the fissures now? What about the fissures now? Let's talk about the fissures. So for the fissures, this is how they actually move. Okay, so for the fissures, this is actually how they move. So I'll start with the common fissure, which is the horizontal, the oblique fissure. So if I move from the apex, right? If I move about 6 centimeters going down, right, and then I put a mark, that will actually be the starting point for the oblique fissure, right? And then I follow, right? I actually follow rib number 6, right? So I actually follow rib number 6, right? On both sides, I'll be following the rib number 6, going anteriorly, right? Following rib number 6, right? That actually will be our oblique fissure until it gets there. So that's the oblique fissure there until we get there, right? So you see that on the inferior border, the oblique fissure will come to end at the anterior most part of the inferior border, right? So there we have it ending over there, okay? Right, so we have it ending over there, right? So remember, 6 centimeters from the apex, then we follow rib number 6. Okay, so actually follow rib number 6 there, right? Up to the sternum, right? There. So that is basically the oblique fissure. So it runs obliquely, right? Then the added fissure now, is then the horizontal fissure. So for the horizontal fissure, you come to the costal cartilage for rib number 4. So the costal cartilage for rib number 4, right? Then you start to follow that costal cartilage, right? Up to you get to the actual rib, right? Then you put a horizontal line, right? Going towards the axilla, right? Going towards the axilla. These two fissures will meet within the at mid-axillary line, right? So if I'm moving from costal cartilage number 4, right? Then I'm following rib number 4, right? Then once I am in the mid-axillary line, or I reach the mid-axillary line, there, right? The fissures will actually meet. So there we have the fissures meeting. So that is the horizontal fissure there. Now we're together, right? So I'm saying if I'm looking at a patient laterally, okay, so if I'm looking at a patient laterally there, so if I'm actually looking at a patient laterally, this is what I'll be seeing. Okay, so the fissures, we have the oblique fissure running downwards, right, like that, following rib number what? Rib number 6, right? And then I said for the horizontal fissure, you move from the sternum, right? It's rib number 4. So you start with its costal cartilage, obviously. Then you move back, horizontally, you move back. They will meet at a line, right? That is actually the mid-axillary line. So they'll actually meet at the mid-axillary line there, right? So remember, I said from here to the apex of the lung, it's actually 6 centimeters. So it's actually 6 centimeters, right? Then you move down, right? Following rib number 6. Then for the horizontal fissure, you move from costal cartilage number 4, right? Costal cartilage number 4, going backwards. And then these two fissures will meet within the mid-axillary line. Please, if they say anterior axillary line, it's false. Posterior axillary line, it's false. It's mid-axillary line. So it's actually the mid-axillary line, the mouth, right? That's where they meet. So that's about the surface anatomy for the lungs. And then we say that lungs actually extend into the neck there. Okay, so that's about the lungs. All right. So let's look at the differences now between the left and the right lung. So we talked about these, the fissures, right? So can you see where they're meeting the mid-axillary line, right? Following rib number 4, this one continues with rib number 6 until it reaches the anterior most part of the, so this is the lower border, right? The anterior border, the posterior border, and then the inferior border there. So the anterior most part of the inferior border, that's where you have the oblique fissure reaching, okay? And we say these fissures are also on the medial side. So can you see that one? That's the oblique fissure there. That's the oblique fissure, this one. That's the oblique fissure there, right? Reaching the anterior most part. This is very important for you to know where it to actually reach. Because one may mistake to say, ah no, this is actually the oblique fissure. No, can you see it's not even on the inferior border? Okay, right? That is actually the horizontal fissure there, right? Right. So there, this is now the right lung. So you actually know this is actually the right lung. This is actually the right lung. So this is medial surface, and that is the lateral surface. Okay, right. And then that is the left lung, right? So then you see it just have one fissure only, right? That fissure, which is the oblique fissure, right? That is the oblique fissure, reaching the anterior-most part of the inferior border, right? Very good. And then if you can understand, if I just ask you which border is which now, is this the anterior border or the posterior border? Because you may get that confusion within the spot test. The anterior border is sharp, like we said. So can you see the anterior border is sharp? The posterior border is actually rounded. The posterior border is actually rounded. All right. So for the left lung, there's something that we have to talk about now, right? For the left lung, there's something that we have to talk about. So you see that the anterior border now, right, instead of coming at this point there, right, actually, there is no part like that, right? So that is what we call a cardiac notch. So that is the cardiac notch. So this whole notch there, that's a cardiac notch produced by the apex of the lung. So the apex of the lung there. Sorry, the apex of the heart. And the apex of the heart. All right. So remember, I said the anterior border is notched. The anterior border of the left lung is notched, right, by the apex of the heart. Then we have this fossa here, right? This impression, right? It's also called a cardiac impression, right? Or a cardiac fossa. So this is a fossa, that's a notch there, right? So the fossa here is produced mainly by the left ventricle. So it's produced mainly by the left ventricle there, okay? Right, that's an impression. From the left ventricle, we have something coming from the left ventricle, which is the arc of the aorta. So they will be having the ascending aorta, the arc of the aorta, right? Descending aorta, right? So if they ask you the structures in contact with the left lung, now you know, right? So we have an impression for the heart, right? Then we have an impression for what? An impression for the arc of the aorta there, right? And these impressions are for the branches, the arc of aorta, right? These impressions are for the branches of the arc of aorta, all right? That's so simple, just that, right? Then we go on to the right lung. Which impressions do we see there, right? So firstly, we have this impression. It's also a cardiac impression, right? But this one is smaller, right? This one is actually smaller and not even deeper compared to the left, okay? Right, that's why this lung is actually larger than the left lung, right? So this one is created mainly by the right atria. So the right atria is the one that creates that one mainly, right? So the right atria. And which veins now, which veins are actually, draining into this atria there, right? Which veins are actually draining into the right atria, right? So we can now see what type of impressions do we have there. Right, we can actually see the impression that we have. We talked about a vein, right, that arches over the hilar or the root of the right lung, right? We talked about that one, right? What exactly is that? That is the azygous vein. That's actually the azygous vein coming over there, right? That's actually the azygous vein coming over there. And this impression over here, it's created actually by this impression is actually created by the inferior vena cava, just getting into the right atria. Okay, right? So that is actually the azygous vein arcing over there, right, to drain into the superior vena cava, right? The superior vena cava. Are we together there, right? And then you have this impression that's for the arteries actually, for the arteries going to the upper limb there, right? Right? And this one will be created mainly by the brachiocephalic trunk, right? And that one, it's by the subclavian artery, right? Are we together? So you see, azygous vein ascending, right? Draining into the posterior part of the superior vena cava, right? So that's how simple these things are. Okay, so that's the difference between these two lungs there, right? We also look at the difference between the hilar, right? There are differences there with the hilar, right? There are actually differences there with the hilar there, right? Now, then let's look at the hilar, right? Say the differences. Now I have to draw this, right, so that you guys can understand, right? Okay, so we start, I'll show you something so that you guys don't even have to cram this thing. For the trachea, right, it descends down to the level of the sternal angle, right, and then divides, right, into a left principal bronchus and then a right principal bronchus, right? But I want you to note that the right principal bronchus will actually divide into 3 lobar branches, right? And then this one will divide into only 2, right? Because here we only have 2 lobes, right? This one actually divide into 3. So superior, right? But the superior branch, so the superior lobar bronchus, right, will be given before this guy enters the hilar of the lung. Okay, will actually be given before this guy enters the hilar. Okay, so we expect that at the hilar of the lung, the superior lobar bronchus, right, will also be seen. Okay, so it will quickly give this guy to go up, right? That's very, very important for you to understand, right? Because there's significance with that. So we're done with the trachea there. Then we move on to the pulmonary trunk, right? So remember, we talked about the pulmonary trunk, right? The pulmonary trunk there, right? And then we talked about its 2 branches, the right pulmonary artery and the left pulmonary artery. But we said that the right, it's a bit ascending, right? So remember what I said yesterday. The right is a bit ascending, and then the left one, you know, it's a bit descending. Okay. So those are the branches of the pulmonary what? Pulmonary trunk, right? Giving deoxygenated blood to the lungs, right? Then the lungs give oxygen to this blood, and then let's talk about this blood coming back to the heart now. We talked about the pulmonary veins, right? That are 2, right, from each side. So they're actually 2 from each side. They're actually 2 from each side. Limbi, stop doing that. They're actually 2 from each side, going where? Into the left ventricle. They're actually 2 from each side, going into the left ventricle, actually. Okay, so they actually be going into the left ventricle. So let's look at the structures, this structure, to say, if I look at a hilar, right, what is the general arrangement of these structures? So if I look at a hilar, what is the general arrangement of these structures? To say, no, this is actually the left lung, it's actually the right lung. And for you to identify which structures are these on the hilar. So can we see that because the superior lobar bronchus was given before entrance into the lung there, right? We'll say we have the bronchus superior at the hilar. Then we have the artery, right? The pulmonary artery there, that's A. Then we have the veins. So always the veins are inferior. The veins are inferior because they are going to the left ventricle. The veins are all inferior. So this side, I'll just write a V there, right? Then this side we have exchange. Because this guy is ascending, right? Actually ascend above, right? So we have the artery superiorly, right? And then the bronchus inferiorly. So you can see, now you can't even claim. It's all clear now, right? It's all clear like that. Okay. So that's how you know this is the hilar of this lung. We're only left with 10 minutes there. Okay, right. So here we are, right? So here we are. So we want to look at this straightly there. Okay, right. So I want to start with the left lung. So there we have the left lung there, right? So remember what we said at the left side, right? Artery there, right? Artery there, right? So actually have the artery over there, right? So actually have the artery over there. Okay. Actually have the artery over there. And then if you are there, we have the bronchus, right? That's the general arrangement. Okay. Then we have the bronchus there, right? And then inferior to that, we would find the vein over there. Actually find the veins. These are also veins, but coming from the superior lobes there, right? But that's the general arrangement that would actually help you to identify, right? And one thing, if you're in a dissection room, right? This the bronchus, you would identify it not with color much, no, because they won't be any different in color actually. But you identify that by presence of cartilage. Okay, so it will be stiff, okay, compared to these ones. So this one will be stiff compared to these ones, right? And for you to know, no, is this a vein or an artery? You look, obviously, the artery has to be superior. It will be the most superior structure, right? And the other things that you see there will be veins. All right. Then let's go to this guy. So you can see the superior lobe, right? Being given there, right? Being given there, right? So it's actually superior, right? This highlight was cut a bit deep, right? And then what do we have? So that's the B, right? And then the A, that's an artery, then the veins inferiorly there. Okay, so that's the general arrangement. Okay, so that was an arrangement from superior to inferior. Are we together? Right. And then in terms of anterior to posterior, I want you to note this thing. The veins are always anterior to everything. So the veins are always anterior to the arteries in terms of coming from anterior to posterior there. Okay, right? So can you see there? That's anterior to posterior. So anterior with the veins, right? But the most important relations are these ones. And we say that for the bronchus, you always see them by the presence of cartilage. So they actually be stiff. All right. So that's the reason why everything looks like that. All right. So anyway, the lung generally has got lobes, yes, 3 lobes, right? But the 3 lobes are then, these lobes are then divided into segments, right? That we call the bronchopulmonary segments. They're actually 10 in number approximately for each lung, right? The left lung, some say that it has got 8, but generally for you just know 10 segments. Okay, so actually you have 10 segments. This one's shown in different colors there, right? Actually be having the 10 segments there, right? But for you, I want to tell you, don't worry about the names of these bronchopulmonary segments. Nah, just know we have the 10 segments in the structure of the segment, which I'll talk about. For all of these, it's useless, right? For you, it's actually useless there until you want to do surgery, unless you want to do surgery there, right? Anyway, so those are the bronchopulmonary segments, right, in different colors, right? So what then is this bronchopulmonary segment? So it's really a unit of a lung, right? So it's a part of a lung, right? So that's a bronchopulmonary segment. Okay. So you see, it's supplied by this bronchiole there, right? That bronchiole there, right? And then dividing. These are the alveolus, right? Microscopic structure there, right? Right. And then we have these blood vessels, right, over there, right? So actually, the color codes here don't confuse with the normal color codes. This is actually a vein, right? So that's actually a vein, right? Right. That's actually a vein. They are coded in terms of oxygen content. So there is the veins because they actually put oxygenated blood. Now they are going to the heart. So the pulmonary veins, and this is actually an artery. Okay, so you guys know this from your, even the whole level that you were taught about this, right? That's an artery coming with deoxygenated blood, getting oxygen, leaving, right? One thing you have to note is that this pulmonary segment, right, actually has got connective tissue outside. And within this connective tissue, what you will find is these arteries there, right? So actually the actual bronchopulmonary segment, right? The actual bronchopulmonary segment does not have the veins. So actually the veins are outside the bronchopulmonary what? Segment, right? The veins are actually outside the bronchopulmonary segment, right? But we're calling them veins in terms of, returning back to the heart, but actually they've got oxygenated what? Blood, okay? Don't be confused with those color codes. So bronchopulmonary segments, they're actually 10, right, per lung, right? And then they are the anatomical, physiological, and surgical unit, right? We'll explain this later on, actually the surgical unit of a lung. They are pyramidal in shape with the apex facing towards the hilum. So if you've got bronchopulmonary segments, they actually be 10 there, all pyramidal in shape, and their apexes are facing towards the hilum of the lung. That's very important. Okay. And then there's connective tissue between the segments. So there'll actually be connective tissue there, connective tissue over there, right? And then each segment is supplied by a segmental artery, right? So remember, segmental artery, that's actually from the pulmonary artery, right? Segmental artery from the pulmonary artery, that is good carbon dioxide, right? Actually, it's got carbon dioxide. Then also supplied by the autonomic nerves, right? And then the segmental veins, okay? So it's also supplied by segmental veins, and these are the segmental veins then join to the pulmonary vein, okay? Are we together? Join to the pulmonary vein, now it's carrying oxygenated blood. And remember, I said that the segmental vein, right, lies outside the segment. So it lies within where? That space. So actually you have the segmental veins outside. They usually ask that. Okay, fine. Then what is the clinical relevance? We do what we call segmental resection, right? So if there is cancer there, right, there, and it's localized there, it's so safe to just come and remove that part of the segment. So you see the advantage. Just quickly come, remove that part, right? Just like what we do with the breast there. Let's remove a lobe, right? So here you come, that is what we call segmental what? Resection. Okay, that is the clinical relevance, right? And let's look at the neurovascular supply of the lungs. So the oxygen for the lungs, right? Now, I want you to forget about the lung supply gives oxygen and then, gives, receives blood with carbon dioxide from the heart and all that. But the actual cells within the lungs, where do they get their oxygen? It comes from the bronchial arteries, right? So actually comes from the bronchial arteries, right? Which are branches of the descending aorta, right? So first part of the descending aorta, they with the bronchial arteries, fine. And then where does the venous blood go? The venous drainage is through the bronchial veins that drain into the azygous vein, right? Actually, the azygous vein, right? That's simple. And then the lymph, right, drains through channels, right, to the bronchomediastinal vessels. So remember these ones. These are the vessels that we saw when we did a lymph drainage of the thorax, right? For the left side drains into the thoracic duct, and then for the right side leads to the formation of the right lymphatic trunk, right? Then the vagus nerve, right, and the sympathetic. The vagus nerve and the sympathetic, they form a plexus that is the autonomic nerve supply to the lung. Okay, so we said the oxygen coming from the bronchial, the veins then drain into the azygous vein. Okay, so this has nothing to do with oxygenating the blood. Nah. This is only to do with supply of oxygen and taking away carbon dioxide from the connective tissue of the lung. Okay, nothing to do with the alveoli thing, right? So that is basically it, ladies and gentlemen, right? So with our time, we end there. Then nextly we'll look at breathing mechanisms and some of the relations at the height of the lung. Okay, so there's only like a minute left there. So anyway, that is what we had to talk about today. Okay, I hope you guys got it. We'll talk about the other stuff in the next segment of this tutorial. Okay, so that is the lecture, guys. Okay, so I'll have to stop and then we can decide if we have to have another one. Okay, right. So good time, Zoom posters thing.